Okay, so I don't have a basin, I can't find it, and then I don't have gloves. So I'm just gonna visually show you guys me like putting them on and then taking them off and stuff. And then I've already pre-filled this, but I will say that I'm like filling it and making sure that I'm having her check her temperature. Okay, here we go. Knock, knock, knock. Hi, Mrs. Jones. I'm Charlie's student nurse here today, and so I'm going to be providing perineal care for you, which means I'm just going to be washing your genital area. Okay, Mrs. Jones. Okay, so I'm just going to make sure my bed is in low and locked position. You can see the bed moving while I'm doing that. I'll pull my privacy screen. I'm going to make sure that her call light is within reach, so I'm going to put it right, with the pencil right here, I'm going to put it right here in her hand so that she has it. And then I'm going to go and fill up this with moderate temperature, so I'm going to go fill it up, and then I'm going to have her check the temperature, so make sure that's okay. Yeah, that's okay. Okay, good. So I'm going to put it right here. And then I'm going to put on some clean gloves. So I'm going to put on my clean gloves. And then I'm going to expose my patient without overexposing. So I'm exposing from the waist to the knees. But since it's a stuffed animal, it's kind of hard to do that because it's a really small area. And then I'm going to take my linen protector and I'm going to place that under her so that the bed does not get wet. And I'll take extra steps and her call light is within reach. And then I'm going to take a washcloth and then I'm just going to wet it. So I'm going to wet it like that. And then I'm going to apply soap, 1 pump. Get that all nice and soapy. And then I'm going to fold it into 4s. And then I'm going to, with one wipe on one side, I'm going to wipe from front to back. So just like that. So front to back. And if I want to wash it again, I could just flip it to a new side and then do it again front to back. Just like that. And then dispose my linen, which is just going to be on the ground over here. And then I'm going to take another washcloth and then I'm going to rinse it. So I'm going to wet it again with my water. And then I'm just going to fold it into 4s in case I need to do it again. And then I'm just going to rinse. Just like that. And if I want to rinse again, I can just flip over to a new side and rinse again. And then dispose my dirty linen. And I'm going to use the linen protector and I'm just going to dry. Depending on if the skin is sensitive or not, I would pat. Or I can just rub dry, but it's recommended to pat. So I'm just going to dry it. And then I'm going to remove this real quick so I can turn on her side to wash the buttocks area. So I'm going to remove this real quick and set this to the side. Okay, Mrs. Jones, I'm going to have you turn on your side. Can you bend this knee for me? Okay. And the guardrail is usually up if we're doing this, or I can just have another student nurse aide, or I can have one of the state officials help me hold her up. But I'm going to have you turn on your side now, okay? So without overexposing my patient further, just make sure that she's covered. Her call light is within reach. Then her hand on the other side, I've already moved it. And then I'm going to place my linen protector back down underneath the buttocks so the bed does not get wet. And then I'm going to take a new washcloth and I'm going to wet it as usual, just like that. And I'm going to do 1 pump of soap. Make sure I get that all nice and soapy. And then I'm going to fold into 4s, just like that. And I'm going to wash front to back, just like that. And if I need to wash again, I can just flip over to a new side and wash front to back. And then dispose of the dirty linen. And then I'm going to grab my other washcloth. I'm going to wet again, and I'm going to rinse. I'm just going to rinse with 1 swipe. And then dispose my linen. And then I'm going to use the linen, and I'm just going to pat dry or rub, whatever the patient feels is necessary. And then that part is done. So then I'm going to remove my linen protector right here, and I'm going to dispose of this. And then Mrs. Jones, I'm going to have you turn back on your side. Thank you. She's nice and clean. And her call light is within reach right here. And I'm going to cover her back up. And then I'm going to make sure that her call light is within reach, so that when I go to empty, I'm going to go empty, rinse, and dry. So I'm just going to take you guys to the bathroom, just so I can show show this because it's easier. So I'm emptying, rinsing, and then I don't have paper towel, so I'm gonna dry it and then dispose of it in the dirty linen area, or the dirty disposable area. And then I'm going to make sure that I dispose of all my linen properly. Then I'm gonna make sure that my bed is in low and locked position. Her call light is within reach, right here. I'm gonna pull my privacy screen back. I'm gonna remove my gloves, so I'd pinch the palm, take my glove off like that, and then 2 fingers like that. Dispose of those. I'm gonna wash my hands, privacy screen back, bed is in low and locked. Call light's within reach. She's covered up and good to go. Is there anything else I can do for you today? No? Okay. And then skill complete.